Hello, everybody, and welcome to our Prevention Works Live. So the exciting new series of webinars and podcasts with some of Australia's leaders in public health who talk to us about their work and how they've been creating change for the prevention of chronic disease. I'd like to begin today's session by acknowledging the traditional custodians of the land of which I sit, the Gadigal people of the Eora Nation, and also acknowledge the traditional custodians of the various lands from which you may all be joining this event. I pay my respects to elders past and present, and also acknowledge all of the Aboriginal and Torres Strait Islander people who are joining this event. My name is Lucy Rychetnik, and I'm the co-director of the Australian Prevention Partnership Centre, a role that I share with my fellow professor and co-director Andrew Wilson. So just a little bit about the Prevention Centre. We're a national partnership. It includes researchers, policymakers and practitioners who are working together to find innovative solutions for chronic disease. We report research, we support its translation into evidence-informed policy and practice, and build capacity of the next generation of prevention leaders. And these Prevention Works Live webinars aim to provide opportunities for you to hear directly from some of Australia's leading prevention innovators. We try to provide a window into some of the behind-the-scenes thinking and behind-the-scenes thinking and the challenges and solutions that our speakers have identified and overcome. And the sort of really interesting insights that you don't normally get from a paper or a conference presentation. So today our guests are Professor Amanda Lee at the University of Queensland, talking about building food security in Australia. And we're also joined by Associate Professor Catherine Backholer from Deakin University. So Mandy is one of Australia's leading public health nutrition experts. Currently, she's Professor of Public Health in the School of Public Health at the University of Queensland and has nearly 4 decades of experience both as a practitioner and a researcher in nutrition, obesity, chronic disease prevention, Indigenous health and public health policy. She's also a long-time lead investigator with the Prevention Centre, having been with us since the beginning in 2013, and leads a number of our projects on food systems, food security and chronic disease prevention. She's also worked very closely for many decades with Aboriginal communities in remote Central Australia who've demonstrated that feasible and affordable improvements in food supply in those communities are possible and can significantly improve the nutrition and health status of the people in those communities. Mandy's also done extensive work with government, so for over a decade she led the development of a strategic approach to tackle poor diet and obesity for Queensland Health, and has held roles like the chair of the National Health Medical Research Council Dietary Guidelines Working Committee. She's also developed some standardised methods for measuring the affordability and pricing of healthy diets. In fact, Mandy's contributed to so many state, national and international policies, it's impossible to name them all. We'd be here all day. But suffice to say, she is a true master in this field, and we're really delighted to welcome you to Prevention Works Live. I'd just also quickly briefly introduce you to Catherine Backholer, because one of the other really exciting opportunities with Prevention Works Live is to invite emerging leaders to join us in the conversation. And today, Catherine's going to be commenting on Mandy's presentation and contributing some of her insights from her own experience. So Catherine is the National Heart Foundation Future Leader Fellow and Associate Director of the Global Obesity Centre, a World Health Organization collaborating centre on obesity prevention. I've seen Catherine speak a couple of times in online events recently, and I've been inspired by the really innovative work that you're leading, Catherine, particularly in your research around the commercial determinants of health, how these impact on equity, as well as studies using social media, artificial intelligence, something called data scraping, which sounds a bit scary, but from what I understand, it's computers basically collecting data from the outputs of other software. And she also draws on things like citizen science, epidemiology, policy analysis, and ethnography techniques. So thank you very much, Catherine, for joining us, and I really look forward to hearing your insights as well. So the format today is an hour. We're going to hear for about 15 minutes from Mandy, followed by about 5 or 10 minutes response from Catherine, and then we'll open it up to a sort of question and answer conversation. And all of you listening live are also welcome to contribute your own questions. So you should be able to do that by clicking on the blue hand icon in the top right-hand corner of your screen. And we'll try and incorporate as many of those questions as possible into the conversation. So with that, I'll hand over to Mandy. Really excited to hear what you have to say, Mandy, and over to you.
Thanks very much, Lucy. Hi, Catherine, and welcome everybody. Thanks for joining us today. I'd like to add to your acknowledgement of country, Lucy, by acknowledging the Jagera and the Turrbal people, who are the traditional owners of Meanjin, Brisbane, from where I'm joining you today. So in Australia, at least 15% of deaths and 8% of deaths are attributable to dietary risks. Surprisingly, these figures make Australia one of the most well-nourished countries in the world, because the major challenge is that these data pertain only to the whole population. However, our diet is not equitable, and many groups, including low socioeconomic groups, and as we can see here, Aboriginal and Torres Strait Islanders, suffer disproportionate burden of diet-related disease, equivalent to some of the poorest countries in the world. So it's fitting that I first learned about food security and system science, for that matter, in Central Australia on the Pinjarra-Yankunytjatjara lands. So here are photos taken in Urunju, Western Australia in the early 1980s. They show Anangal drawing their food system. The work was then used in a submission that resulted in a new display fridge for the community store at that time, which was just a shed which stocked little more than flour, sugar and tea. Their concepts, with those of public health perspective, show our food system needs transforming to better deliver three main outcomes: health and well-being, equity and sustainability. As we've all seen in the current COVID pandemic, our prosperity is dependent on all three existing simultaneously. And food security is a really critical feature of this. So there's many definitions of food security, but I like this one from the WHO FAO that says food security exists when all people at all times have physical and economic access to sufficient, safe and nutritious foods to meet their dietary needs and food preferences for an active and healthy life. My work's focused on household through to regional levels of food security, and others could talk more about individual and global contexts. But one of the challenges is at the global commodity level, the food security tends to focus on food quantity, such as efforts to feed 50 billion people by 2050. But from a public health perspective, the issue of food quality really needs to be front and centre. Importantly, food security is also a universal human right, not a right to be fed, but the right of people to be given a fair opportunity to feed themselves now and into the future. Food insecurity is related to all aspects of malnutrition, and it may seem paradoxical that this is both overnutrition through high intake of unhealthy food, but also undernutrition through insufficient intake of healthy foods, usually in the longer term. The key components of food security are availability, access and utilisation, which can be broken down even further to align with the 6 A's in the triangle diagram, and I'm going to be speaking a little bit more about those. As we've all been seeing recently, food security is affected by both gradual change, such as climate change and population growth, and also by sudden shocks, such as bushfires, extreme weather events and pandemics. But it's highly amenable to public policy in the area of those 6 A's, including through trade, agriculture, welfare, fiscal, as well as health policy. So it's a really particularly rewarding area in which to work. In Australia, food security is assessed in national nutrition surveys, and in the last 2011-13 survey included just 2 relevant items in a rather blunt instrument. Nationally, 4% of the population reported living in a household that over the past year had run out of in that situation ended up going without food. But over the last 10 years, population estimates of food insecurity have ranged up to 36%, with even higher levels amongst specific groups and settings such as refugees. And this really helps suggest that the national figures are a gross underestimate and simplification. For example, in 2019, even before the COVID pandemic, the Food Bank Hunger Report found 4 million Australians were suffering food insecurity. Unfortunately, the data are rarely compatible, but the good news is that the ABS are currently investigating adoption of a much more robust, validated tool for use in 2023, so we should have better data then. Unfortunately, there's also evidence that food insecurity has increased during the current COVID pandemic. Last year, demand for food relief increased by 47%, and ACOS now estimate that 1 in 6 Australian children live in households that are food insecure. So the main reasons reported for this have been job losses, just not enough money, and that food is too expensive. Like all issues in public health, if we want to improve policy, we really need to better understand the current situation and go from there to a vision of the ideal. So I might spend a moment looking at what Australians actually are eating. Overall, less than 1% of us consume diets consistent with dietary guidelines from the NHMRC. Yet following these recommendations would be healthier, more equitable, and produce at least 25% less greenhouse gas emissions than the current diet. To help illustrate the changes required, here's a photo of the foods a family of 4 report consuming per fortnight in the last National Nutrition Survey. And here's what the same family could consume if their diet was more consistent with just the minimal change recommendations of the dietary guidelines. So this is still an omnivorous diet, but they could adopt a vegetarian diet, a Mediterranean diet, or an Asian-based diet. All those were modelled in the Dietary Guidelines Work Program. So this is just the minimal model. But even these minimal changes are actually quite radical. In this graph, we need to eat more proportionally of the foods with green bars, such as legumes here, 470% more, and less of those with red bars. Either way, the biggest problem is the bottom bar, which shows we need to reduce unhealthy food and drinks, whether we call them discretionary, ultra-processed, junk food, whatever we want to call them. These unhealthy options provide over 35% of our energy intake, and that amount is even higher amongst our children. We've seen a common barrier to healthy diets is the perception that healthy food is too expensive. Surprisingly, though, when we costed the fortnightly diet of that family on the left and compared it with the cost of the recommended diet on the right, with all the food groups shown, a healthy diet was actually less expensive than the current diet, partly because we include alcohol in the current diet. It's 12% of our expenditure, but mainly because basic healthy foods don't incur GST in Australia. Importantly, though, even under those current policy settings, healthy diets are just not affordable for low-income groups. And worryingly, this red bar here shows that families are spending 58% of our food budget on unhealthy food and drink. So this really raises the question, who benefits from the status quo? Further, a wonderful PhD student, Marion Lewis, has shown that when low socioeconomic groups adopt a common budgeting strategy by avoiding the branded items where costs are shown on the left, and they buy the cheapest options, which are usually generic products, as shown on the right, both diets become more affordable, the current diet and the recommended diet, but healthy diets actually become more expensive than current diets for these groups because the cheapest generic options in Australia are predominantly the less healthy ones. Surprisingly, there was little granular information on the diet costs of the population by household income. So Mirren has analysed the curves from the last nutrition survey with very revealing results. In this graph, the grey columns show the total cost of diets for that household of 4 by income quintiles. The 5 red and green columns show the cost of the component food and drinks, red being unhealthy and green the healthy items. The final column is the cost of the recommended diet, which is the same for everybody. As could be expected, there's a significant trend of increased total diet costs from the lowest to the highest quintile, this blue dotted line. And there's also a significant trend in increased cost of the healthy components of the diet, this green line. But surprisingly, there was no change in the proportion and the costs of unhealthy food and drinks, the red line. So unfortunately, this shows that it's no wonder that low-income families have poor health outcomes, and it's a sorry example of food insecurity in action in Australia and the inequities associated with that. The problem is the junk food. In Aboriginal and Torres Strait Islander communities who report even higher intakes of unhealthier food and drinks, there's multiple historical, political and socioeconomic determinants of health that underlie food security, insecurity. However, it's exactly the strengths, resourcefulness and resiliency of these communities that's showing the way to improve food security. Despite poverty rates being highest in remote areas, the dark areas of this map, which align exactly where the cost of food is 30 to 60% higher than urban areas. For example, even with rates of food insecurity in the national survey that were nearly 8 times higher than non-Indigenous Australians, far fewer people actually go without food in remote areas. Partly, this is because they're protected by strong cultural food knowledge and other cultural knowledge, kinship relationships and pooling of resources, exemplified by these wonderful quotes about food security captured by my colleagues at Menzies. This work has been translated into successful community food security projects in remote areas, such as the recent Partnership Prevention Centre program with communities on the APY Lands. Here the intervention was just this, to do anything that the community asks to improve food security. In just 12 months, the 2 intervention communities dramatically improved food supply, the availability, the product placement and the promotion of healthy foods in their stores by developing and implementing a revised store nutrition policy. On the demand side, activities included traditional bush trips, bush picnics, cooking sessions, working with youth groups and preschoolers, and ongoing housing programs to fix what's called health hardware, the things needed for food preparation and storage. Only 6% of houses were actually functional in that regard when the survey was conducted a few years ago. The amazing results of this project in such a short time, 12 months, showed that healthy diets were 20% less expensive than previously. There was a reduction of sugary drinks from 60 to 40% of all drinks. Fruit and vegetable intake from 145 to 212 grams per person per day. But importantly, there was a decrease in energy from unhealthy food and drinks, which dropped from 45% to 39%. And that was the first decrease we'd seen with the work in these communities for over 40 years. These results were consistent with similar projects in Arnhem Land in the 1980s, the same intervention, doing everything the community asked us to do to help. In this project, biochemical indicators of nutritional status were also assessed every 3 months, and they showed dramatic improvements, including reversal of diabetes, reduction of risk of heart disease, and normalisation of BMI. Such work has led to the development of food system tools for remote areas on the left and urban areas on the right, and they can also be used to inform broader work. For example, few people realise that the dietary guidelines for Aboriginal and Torres Strait Islander people are enjoy traditional foods whenever possible and eat store foods that's most like traditional foods. And what I find amazing is I think they would be wonderful dietary guidelines for the whole of Australia. But the problem is we'd have to sufficiently educate all the non-Indigenous Australians before implementing these. The systems approach helps reinforce that sustainability is essential to ensure food security now and into the future. To achieve sustainable diets, we need to do four main things: decrease food waste, energy intake of unhealthy food and drinks, and increase the proportion of healthy plant-based foods in our diet, which doesn't mean more breakfast cereal with lots of added sugar. So there's a high synergy between what we need to do for our health and what we need to do for the health of the planet. The good news is we've got really good evidence about what needs to be done. Globally, there's no shortage of targets and strategies, etc. However, in Australia, we do have a current food and nutrition policy vacuum. But the main problem is that we're just not implementing the required actions, such as outlined in the Nourishing Policy Framework. For example, all OECD countries are happy to tell our populations to eat more healthy food, the green bars, but very few discourage unhealthy choices, the red bars, especially through the use of regulatory mechanisms, which are by far the most effective ways of doing this. So urgent policy action is really required. However, there's a very sad history of food and nutrition policy being undermined in Australia. An example followed the release of the draft dietary guidelines in 2011, when a very strange alliance of bedfellows joined a media campaign to oppose Australia becoming one of the first nations in the world to overtly try to deliver healthy, equitable, and sustainable diets. So we've had to try and do that covertly, and that's not as effective as I'm sure everyone would realise. So Catherine Cullerton, who was actually the respondent in the last Prevention Works session, she has done amazing work looking at this by mapping the Australian Nutrition Policy Network, showing regularly who talks to who. In this diagram, the red shapes down the bottom are the policy decision makers, usually politicians, surrounded by the orange bureaucrats, as you'd expect, while to the left, all us nutritionists talk amongst ourselves and maybe with the NGO activists, the blue and the diagram. But those best positioned to influence decision making are actually from the food industry, or the black triangles here in the diagram. But the group I'm most interested in, actually, I'm envious of, called the Industry Front Line in the top right quadrant. And these are the people employed by industry who have the capacity to respond to public consultations on food and nutrition, other than at 2 a.m. in the morning. So Catherine's work in this network analysis clearly demonstrates the inequitable power and influence of the commercial determinants of health and sustainability. Combating this is going to require tremendous political and public will. Effective advocacy, framing, policy entrepreneurs and coalitions are essential to achieving this. So what do we need to do to improve food security? Here's some suggestions under two main areas: improving food environment, covering all those 6 A's again, and tackling the poverty experienced by the most vulnerable Australians. We have some insights into this from a recent natural experiment. With the coronavirus supplements and increased job seeker payments, welfare-dependent Australian households for the first time in May 2020, as seen here in the second bar, could afford a basic healthy diet. And that was confirmed by an ACOS survey that showed 80% reported healthier eating during that time. However, the additional payments have been decreased back to just an extra $25 per week. And so healthy diets are now once again unaffordable for the most vulnerable Australians. And this is a terrible situation to have occurred, particularly in the midst of a global pandemic. Also, every 5 years or so, there's a push to expand the base of the GST, which means adding tax back to basic healthy foods in Australia. If we did this, families, as shown here, would need to pay another $60 per fortnight for basic healthy foods, and that would be more than the additional cost of the unhealthy diet. So a much better idea would be to increase the GST on unhealthy foods and drinks to 20%. The mechanisms are all in there. We could easily do that, and that would act as a universal fat tax, providing additional support for low-income groups. We're really well placed to do this in Australia. So in summary, promoting food security is a key aspect of food system transformation to deliver better health and well-being, equity and sustainability consistent with human rights, and also to achieve at least 12 of the 17 Sustainable Development Goals that deal with nutrition. Urgently, though, we've got to work collaboratively across multiple sectors to develop a new comprehensive national food and nutrition policy action to guide this. So I'd like to finish just by acknowledging all my teachers and the communities that have given me permission to share their stories with you today, and to acknowledge all my past mentors. Thank you.
Thanks so much, Mandy. That's wonderful. So I'll hand over to you, Catherine, to have a few reflections, make a few comments, and you might already have a few questions. I know I've already got a few questions in mind for Mandy, so I'll hand over to you.
Thanks very much, Lucy. Before I start, I'd just also like to acknowledge the lands on which we're all meeting today. For me, I'm on the Wadawurrung land, which is a beautiful part of Victoria, the Bellarine Peninsula. And so I'd like to pay my respects to the Wadawurrung people who are the custodians of these lands and their elders, past, present and future, and acknowledge and respect their continuing culture and the contribution that the Wadawurrung people make to this beautiful region. Then I'd also like to thank Mandy. I've listened to you, Mandy, lots of times before, and every time I listen to you, I always walk away feeling energized and with something new to take away. So thanks for that, and it's a real privilege to be here as a discussant on this forum. I feel like I could sit here and talk to you and ask you a million questions, Mandy, and spend hours, but I know we've got half an hour left, so I'll just spend about 5 minutes reflecting on your talk. And I just want to do so reflecting on two key issues. And the first one is around equity, and I start there because in my work it's really the core of everything we do. So it guides what we focus on, how we analyse our data, what we report on. It's really how do we improve population diets in a way that brings everyone along. So extending some of what you presented, Mandy, I think it's really great to see someone present on equity and food systems and population diets and mention income and housing. And I think one of the things we don't do well as a whole in public health, and that we need to do better at, is changing that narrative of what's needed to prevent obesity in a way that brings everyone along, and making sure that those social determinants of health are front and centre of everything that we do. Mandy, you know Christina Zorbas, who just finished with us as a PhD student. She did a piece of work where she looked at all the major national policy documents around the world for population nutrition, and she showed that in all those documents, equity considerations are really strong in government rhetoric, but they absolutely fall off in action. And so it was great to see when you broke down your actions around what we need to do. Poverty was there right up there as a key focus. And the only other place I've really seen that is the London strategy for a healthy weight, where their #1 strategy is to end childhood poverty. And then after that, you get your marketing and your taxation, all the usual suspects. But the #1 action is to end child poverty for a healthy weight in London. And so I think we can do this by taking a more of a person-centered approach to food policy and, speaking to people who are marginalised, speaking to people who are socioeconomically disadvantaged and understanding what it is that they need to enable healthy food environments, and considering both those policies within and outside of the food system. You also talked about targeted interventions and the amazing work you've been doing with Aboriginal Torres Strait Islander people in Australia from when you first started in the 1980s. And you also touched on more universal whole of population approaches. And I think when we address equity, we need to make sure that we have that dual-pronged approach with the targeted approaches, but also making sure that our universal approaches bring everyone along. And I think we have a bit more work to do with universal policies and making sure that not just single policies are equitable, but the package of policies are also equitable. And I think if we designed every single whole of population approach for Aboriginal Torres Strait Islander people or marginalised groups in society, and then we'd be in such a better position and we'd see the benefits trickle across the rest of society. But we need to design those policies and prioritise those policies with and for the most disadvantaged in society. And then building from that, we need to evaluate the equity impact of those universal approaches as well. And I don't mean just by breaking down by different indicators of socioeconomic position, but understanding what are the relevant outcomes that we do need to collect and measure, and making sure that we embed equity from the start so that we're powered to detect the differences that we want to detect. I think too often it's really done as an afterthought, as a secondary analysis. So the second area I want to touch on is corporate power. So Mandy, you said it today, and I've heard you say it lots of times before, that less than 1% of Australians consume a diet consistent with the Australian Dietary Guidelines. You just need to look at that stat to see that something is seriously wrong with our food system, and no single policy will solve this issue. But my concern is that we've known this for a long time now. You started in the 1980s. We had serious problems then. We still have serious problems now. In the 1980s, we had Life Be In It and Norm sitting on the couch as an education campaign, and now we have Live Lighter. And I'm not downplaying those kind of information-based campaigns. They're absolutely important, but we haven't really moved beyond that information-based approach to addressing population diets. And I think that's a real issue of improving population diets and reducing inequities. So that kind of leads to the major barrier to inaction. And your triangle figure, Mandy, I love those three pillars of healthy diet, health and well-being, health and well-being, equity, and environmental sustainability. But arguably what's not there is financial or economic prosperity. And I assume it didn't make it there because you were really focusing on the public health outcomes that we need to focus on. And it's that predominant focus of economic prosperity that's really led to the demise of our existing food systems, and seeing the concentration of global market power, which is now held by a handful of transnational food corporations. We know that economic power equals political power, and that is the biggest challenge to transforming our food systems to improve population diets, reduce inequities, and get actions in place. So it was really great that you had that square, and the corporate power and those challenges up there as a key barrier. So I'll just wrap up now and with a question. I've actually got two questions I'd love to wrap up with, but I'll combine them into one because so I'm not taking too much time. But as someone who's worked in this space for 40 years or so, and who's come up against the powerful forces of industry time and time again, and who's worked tirelessly to improve population diets and reduce inequities, my two questions for you are you optimistic that we will achieve transformational change in the near future? And if you could go back 30 to 40 years in time with what you know now, what piece of advice would you give yourself as someone working to improve population diets?
Thanks very much, Catherine, and I really enjoyed your reflection. I actually have got prosperity in this diagram, but the issue is whose prosperity? And I think you're exactly right. It has to be prosperity for all and shared economic benefits that we need to be focusing on. Okay. Am I optimistic? Well, I guess we wouldn't keep working if we weren't optimistic. But really, I think we have to be, because our health and the health of the planet depends on actually achieving this transformation. And I think the challenge is, perhaps the word, will this be achieved in the near future? And where I'm perhaps a little bit more pessimistic is I haven't seen much evidence of humans being very good at tackling preventative action until we're actually right in the middle of a crisis. And I've seen that, we've seen that also with the current pandemic. But I think the problem is that what we're talking about is so fundamental to the survival of us and the planet that there could be a tipping point in there, and there's a risk that if we don't do this urgently, it could be too late. So I am worried about the timing there. But I am optimistic that we have to do this, so therefore it would come along. I'm really heartened, I think, in this by thinking about the pandemic. And I know a lot of public health people are saying this, but, you know, who would have thought that we'd ever see decision-making based on public health evidence? And that gives me heart, because we know that that's actually led to protecting Australia and the whole population, but we need more in this area, which is even more complex. I think it's really salient that there's a high degree of concordance between what we need to eat for our planet and what we need to eat for our own human health. And we know that food choice is influenced by taste, both in a physiological and economic sense, and also price then, but also convenience, availability, advertising, promotion. But it doesn't seem to be affected much by concerns about health issues. And that's where I think that, particularly amongst young people, having the concern about the health of the planet, as well as perhaps a sense of fairness and equity that we've seen drive even things like the marriage equality debate was centred on equity. When it was reframed to be about equity, there was buy-in. So I think the equity and the climate change components could actually help young people to pick up those changes. And I think the best thing about working in academia is that you're constantly surrounded by young, bright, sort of thoughtful change leaders that really give us hope. You know, I would have given up a long time ago if it wasn't for those younger people. And I think more broadly too, we're starting to see evidence of economic levers that are driving change. We're seeing that in the fossil fuel industry, where there's a reticence about investing in future fossil fuels. And we're going to have to see that by businesses who not only just want to promote a perception of corporate responsibility by not promoting and selling and marketing all that junk that they do and make profit from, but because there will be a really actual risk to profits if they keep doing that. I think if we can work on that groundswell of demand for change, that's what's going to drive the transformation of the system. What did I wish I knew a long time ago? I think you know, I learned about that systems approach a long time ago, and I should have supported that and proselytized more about that. I think the dominant role of evidence, I think one of the things that really set back nutrition in the last 30 years has been, it's only been in the last 10 years that we've actually had an estimate of the burden of disease due to poor diet. It used to get relinquished to, you know, burden of disease due to fruit and vegetables of 2% or something. And there would be this risk factor envy around where investment went in the prevention space. And I'm really pleased that we don't have to play that now anymore, that there's been some, you know, novel approaches that have helped to control for all the confounding variables that there are in diet. So that I think most people have got an increasing awareness of the importance of diet. But I wish I had understood more about the challenges in decision making when I was younger. And then apart from that, there's all the personal things. You know, I wish I had focused more on work-life balance. I think it's really important, particularly in nutrition, which is a very gendered area. There's a lot of pressure on us to keep working. And, you know, as Lucy said, for 10 years I was Director of Nutrition and Physical Activity in Queensland Health, and it was a really exciting time until everything came undone with the change of government. And all I think now is, you know, our team used to be in there in the office at 6 o'clock at night working really hard. I wish now I'd gone home occasionally at 3 o'clock to pick my kids up from school. So I hope that young people learn more from that. And I think we really need to just understand that we're in this for the long haul, and to celebrate small successes is really important to keep our resiliency going.
Wonderful. Thanks so much, Mandy and Catherine. I just had a quick question. Are you getting an echo with my sound there? Or is it sounding okay? No? Okay. It's just coming back to me. I just had a quick question. It's really fascinating, and one of the things I really found fascinating about your data, and it was just so obvious, is the role of this discretionary foods. And, you know, we can talk about it, but when you actually see the data like that and the big red line at the bottom there, cheap, affordable and highly promoted discretionary foods, which is obviously having the greatest impact, and is really sort of overwhelmingly the issue in terms of the commercial determinants of health. And I think some of the cleverest sort of reframing has been to sort of talk about it in terms of limiting people's choice. And I think you both touched on the issue that really it's about creating opportunity and equity, and I think that's a much more constructive and positive way of framing it. The other thing that really struck me was that map that you said that Catherine Cullerton had done about the nutritionists and researchers all talking amongst themselves and being actually out of the action in terms of influencing decision making. And I guess I have a question for both of you, just to reflect on, so how do we overcome that, and what have you found is the way to really make sure that we integrate the evidence and the knowledge of nutrition and nutrition research in with the decision making, so that we don't become little silos or having our own little conversations in our own space with our little tribe, that it becomes actually you have real influence on decision making. So just in terms of reflecting, you know, on your decades of experience, Mandy, and yours, Catherine, you know, you've been doing a lot of work in this space. What are the key things that we really need to keep in mind, and how do we influence decision making? How do we address these issues? So Mandy, if you start with you.
Oh, okay. Well, one of the things I mentioned was the gendered aspect of nutrition. I think one of the challenges we have in nutrition is that a lot of women are reticent about putting ourselves forward and speaking up, and would tend to try to take a backward supporting view. And I think given the nature of the workforce, that's been counterproductive, and we've really got to get out there a little bit more. But if we're not comfortable, you know, the role of having partnerships is something that's really powerful. So coalitions will really help to drive home the consistency of the message. A policy entrepreneur, you know, looking at some, you know, very well-regarded, high-profile person. I've learnt not to, I'll probably get in trouble, not to trust sporting people perhaps so much in that area. We've had a lot of naughty rugby players that were put into that role before that haven't gone well. So I think we have to get beyond just populist thing, but looking at, you know, some really credible people that have got high profile that can help carry our messages is really important. But the most important to me is having those partnerships and working in harmony so that there's a consistency of approach. And that's what I think the Partnership Centre is really good at, and also groups such as the Obesity Collaboration. They're set up specifically to have more policy impact because of the resonance and the group response to those things. Catherine might have some more ideas. Yeah.
Catherine?
I mean, my first thing I was going to say was exactly what you said, Mandy. I think consensus is really important and making sure we're all saying the same things. You know, we just did a FOI request for all the submissions that went to the Queensland Government policy for restricting unhealthy advertising on public assets. So this went up in the media. Minister Stephen Miles said they're going to restrict unhealthy advertising on public assets at the end of 2019. It was all over the media. There were 2 consultation periods, and we just got all that information under freedom of information. And, you know, public health groups submitted and you know, said the usual things, but the industry, they had submissions to the consultations. They had emails talking about the meetings they just had with politicians. This, you know, speaks to what Mandy was saying with Catherine Cullerton's work. There were so many more interactions than what public health had. And then their messages were so aligned as well. And they had cancer agencies. The Outdoor Media Association had cancer agencies supporting the Outdoor Media Association's message, saying that if the Outdoor Media Association is hit financially, then we won't get our free billboard space and we won't be able to put our cancer messages up. And so I think, you know, working together and trying to get, you know, maybe even spreading further than what we think our collective group is. And these were smaller cancer agencies, but, well, one wasn't. But you know, we need to get everyone on board and we need to be saying the exact same thing, and we need to do more than, absolutely need to do the submissions, but then we also need to be meeting with policymakers and, you know, trying to find a champion to really, you know, flag that, wave that flag for us and try to get some action. I mean, if you look at all the policies around the world that have got across the line, if you look at Chile, you look at some of the stuff that's going on in London, the key enabler was a champion that really pushed it forward.
And I can really see the potential value in the ideas that, Mandy, you discussed about aligning the messages from different sectors. So, you know, in terms of the sort of type of diet that's going to be healthy and sustainable. And I wonder whether you could reflect a bit more on that, and if you have any examples where these kind of coalitions where people may not have the same outcomes in mind, but actually they're making the same policy arguments.
I think, Lucy, there's a lot here we can learn from the experience in tobacco, because what I see increasingly is a wedge being driven between some public health groups. You notice when I was talking about unhealthy foods, I called them, whatever you want to call them, discretionary, ultra-processed, junk, I don't care. You know, but if you put a group of nutritionists in a room, they'll argue all day about what we should call those and how we measure them. It doesn't matter. You know, we have to worry about not the grey in the middle, but those huge big blocks. And I think part of that schism is also driven by industry. Industry in Australia are involved in policy actions such as reformulation of products. I think that might work well for salt and perhaps for added sugar, but there's evidence that for other reformulation activities, it still takes us back to the 1960s where people were trying to make healthy cigarettes. A lot of this junk food is going to say junk food no matter how we reformulate it. You know, we just don't need it in our diet. And I think even things like Health Star rating system, it really worries me that people argue about whether that's a good policy or a bad policy. You know, it detracts from the main issue, which is that we're trying to get out information about focusing on the healthy food and not eating any of the junk, and changing environment that will make it more easy for people to do that. So I think we, you know, in understanding that partnerships and coalitions are the most important thing, and putting aside those little differences is going to be really important. And that's how the tobacco public health lobby was able to work. There were different views about where the investment should be, but people got together and agreed on 3 or 4 big policy asks that they could have, and that there was a sequential logic and a consistency to that ask over time, what we've seen in nutrition is a bit of flip-flopping around. You know, there's different messages that come into favour at different times. And if we could collectively work, and that's why I think having a new food and nutrition policy is really vital in Australia. We were one of the first countries in the world to develop a policy that was underscored by ecological sustainability, equity and health in 1992, one of the first in the world. And as a result, WHO instigated a program where all countries would have that. So even, and nobody ever looks at it, it falls off the web every so often and you have to go finding it, but nobody uses it. But if we had a process that was developing a new policy that would provide a mechanism whereby different groups could come together and work collectively and identify the commonality of our asks and be able to do that in a consistent and constructive manner.
Well, thanks, Mandy. Catherine, do you have anything to add? Anything else you wanted to comment on that point?
I guess only that you know, we also need to make the most of policy windows. If you look at sugar sweetened beverage taxes around the world, they've been driven by Ministry of Finance, not Ministry of Health. So that's why I think it is important to get those partners outside of the health system together as well, because those policies, the sugar sweetened beverage taxes, would not have got up if it was health alone. It was during economic downturn, and it was the Ministry of Finance that really got it across the line.
Yeah, very good point. I've got a question.
Oh, sorry, I was just going to say, in all our work, it's actually other sectors that are most responsible for the changes that are going to have the maximum benefit. It's not health. Yeah.
Yeah. No, I think that's the case across so many areas of chronic disease, isn't it? There's a question from the audience saying, thank you so much for your talks and presentations. Could you reflect? I know, Mandy, you talked about some of the wonderful work that you've done with Aboriginal communities in Central Australia. And are there any other good examples of maybe local council, local government, or micro sort of level initiatives that are doing well or have achieved sort of equitable and sustainable food systems?
Yeah, there's quite a lot of very positive examples. We reviewed services and programs recently for the Australian Indigenous Health Infonet. I think a challenge is that they're quite piecemeal. You know, they work in, we used to have NATS and SAP, the National Aboriginal and Torres Strait Island Nutrition Strategy and Action Plan, about the same time that we had an action document, Eat Well Australia, to implement the food and nutrition policy that existed. And that provided a concerted framework and even an opportunity to report and to share stories about positive approaches that different communities have done. What we have at the moment is a much more fragmented and piecemeal approach. So there's wonderful stories, and part of the challenge is getting the message out. Like even that work that I showed where Minjalang had in Arnhem Land in the 1980s showed the way to tackle chronic disease in that community. I think that that paper's been written up, but it's not available anymore in a full text item. It's in the Medical Journal of Australia and Australian New Zealand Journal of Public Health. And because it's old, there's only abstracts. So, you know, multiply that and multiple times, because it's very difficult for people to have the capacity to write up their own stories and get those shared. We used to have nutrition network meetings for Aboriginal and Torres, run by Aboriginal and Torres Strait Islander organisations quite regularly, but they're no longer funded. So it's hard to get communication systems and that sharing of stories at the level where there could be benefit from that knowledge. Yeah.
Yeah, that aligns well with the Productivity Commission's recent report looking at innovations in chronic disease management, and saying that they identified all around Australia some really wonderful local innovations being led by individuals or small organisations, but really what was missing was that coordination and alignment. And I think, as you're saying, that the sort of the national policy is so important to bring that together. Catherine, any thoughts from you? Any other questions? We're sort of running out. We've got about 5 minutes left, so we're just anything else that you wanted to ask or comment on?
just really quickly, I was just going to say, I think, you know, some of the best stuff is happening at the local level, but it can only have so much impact. You know, it can't remove the McDonald's sign on the billboard as your kids are going to school, and it can't, you know, remove the you know, the huge amounts of junk food advertising that they see when they, you know, scroll through phones or screens. So I think awesome work at local level, but until we get that you know, national level and state level action, you know, we can only get so far.
Yeah, very good point. Okay, so just to finish up, I just wondered if you could both reflect on, you know, what are the 2 or 3 key things that you would like to see implemented in Australia over the next decade to make sure that we change this space and change the food system. And putting you on the spot, even if you come up with 1 or 2, if you had a pick, and what do you think are the most important priorities for us to focus on? Mandy, maybe start with you.
Oh, well, I can cheat because I can encompass everything by saying I'd really like to see the steps starting to get a new food and nutrition policy for Australia, and that would become the umbrella that would capture the detail of all the changes we need to do to help transform the system.
Great, thank you. And Catherine?
And I'll open up Mandy's national nutrition policy and pick out just a couple of actions that will be inside there. And I think it will be around, you know, regulations around how much industry can lobby government and how they interact with government, with decision making. I think they shouldn't be involved at all in the development of policy. They're only involved in the implementation phase. So something with that. And then my one action that I'd love to see in there, and it's going to be biased because I work in this space, but removing unhealthy food advertising across all mediums and settings that kids are exposed to. I think it would change, you know, we know that it would have an impact on food intake, but it would also change the social norms around unhealthy food.
Wonderful, thank you so much. Well, that was a fantastic session, really inspiring. Thank you so much, Mandy, for agreeing to join us. You're definitely my go-to public health nutrition expert. We really value your role at the Prevention Centre. And Catherine, thank you so much for bringing your fresh perspective. You are the emerging leaders of the future, and it's wonderful to see people like you working in the space. So thank you so much. Just also thank you to all of you who've joined us today, or anyone who's listening to the recording. So we are recording these, and we'll be putting it up on the website if you want to share them with others or with colleagues. And also just to let you know that the next masterclass will be on Thursday, the 8th of July, with Emeritus Professor Adrian Bowman, who's going to be talking about creating systems change for promoting physical activity. And just as a reminder as well to people who've joined us, if you haven't subscribed to the Chronicle, go to our website and subscribe, because you'll see stories from chronic disease prevention around Australia and links through to the events pages, so upcoming future events. But once again, thank you so much, Mandy. It's been really wonderful. And thank you so much, Catherine. It's been a great session. So thanks a lot. And we'll see you soon.
Thanks for having us, Lucy.
Bye. Thank you. Thanks, Catherine. Thanks, Lucy.